Welcome to our Medicare webinar today. Happy Wednesday. I'm Nathan Larson. I'm a wealth advisor at Squire. And today we are lucky to have Craig Valgardson here to present on Medicare. Craig was born and raised in Provo. Craig and his wife are proud parents of 3 children, 2 sons and 1 daughter. In his free time, he enjoys spending time outdoors, especially camping and making meaningful memories with his family. Craig has worked in the insurance industry since 2016, focusing primarily on helping clients navigate the world of Medicare. He specializes in supplemental insurance options designed to help cover what original Medicare does not, such as dental, vision, hearing services, and hospital copays. Every year, individuals receive countless brochures and advertisements, which can make it difficult to know which plan is the right fit. As an independent agent, Craig represents multiple well-known insurance companies, giving him the flexibility to find the plan that truly meets your unique healthcare needs. Craig's goal is to make this process simple, clear, and stress-free. He provides honest, straightforward information so you can make confident decisions about your healthcare coverage. We've worked with Craig here at Squire for several years, lots of mutual clients, and he does a great job. Happy to have him here today. And with that, I'll let Craig start the presentation.
All right, thanks, Nathan. So on Medicare, here are just a few of the top questions that I get constantly asked. So does having an agent cost money? The answer to that question is no. So whether you go online, over the phone, or use an agent like myself, the prices are set. Yes, I get compensated by the insurance company. The compensation is already built into the program. So for instance, there's multiple programs that have a 0 premium, so you don't necessarily pay any more than what's already coming out of your Social Security check or your Part B premiums, but it doesn't cost you any more to have an advocate like myself to help you through it. So what I can kind of help you do is go over prescription drug formularies. We can run providers, we can run facilities. Like this year, there's a lot of disruption. There's carriers leaving markets, there's carriers leaving counties, and I've been the past few weeks just going over doctors and facilities of existing clients, helping them find a new option moving forward that helps fit their needs. So is Medicare one size fits all? The answer to that's no. So like Nathan mentioned, I work with multiple carriers. I have clients with all the carriers. I mean, it just really depends on your needs. For instance, if you have a lot of health concerns, a lot of health issues, you're going to want a plan that covers you more medically wise, and maybe you would give up some additional benefits that way, or all of them, just depends. Like I have marathon runners, they're on programs that they hardly ever go to the doctor, hardly ever use their insurance. They just want to be covered for catastrophic. I have other clients that get blood infusions every 6 weeks, and that's really expensive. So they'd be hitting their max out of pockets way sooner than someone who's never using it. How often should we review the plans? Usually once a year. I mean, we'll go over kind of how the Inflation Reduction Act has affected the Medicare plans and what's kind of moving forward, what it's looking like that way. But you'd want to at least review them every year. If you're one of my existing clients, I send you out a letter every year just kind of explaining the main changes. And then most of the carriers tell us in our portals, so if it's going to affect you drastically, then I'd reach out, we would set up a time, and then we'd meet that way as well. And then does Social Security affect the Medicare payments? So Social Security itself, no, but your income, like the IRMA taxes and things like that, the answer is yes. So depending on where you are income-wise, like say you sell a property, you get a big inheritance, you definitely want to talk to the people over at Squire. They can help you, lessen that tax burden and hopefully keep your Medicare premiums down as well. And then how far in advance should you get started with the process? So this is kind of a 2-part question. So if you're brand new to Medicare, you're becoming eligible for the first time, then 3 months before is when we want to start the process to get everything submitted into Social Security. If you're coming off group insurance and retiring and already past your eligibility age, then that's a 60-day window. So it's basically either 3 months or 60 days. And then if you're coming off group insurance, we do have to submit additional forms, which get you the late enrollment penalties waived. So on Medicare. So the very first step to getting on Medicare is everyone's going to apply for the red, white, and blue card. So you have your Part A and then your Part B. So Social Security runs the Part A and Part B. They basically tell Medicare that you're eligible to enroll in private insurance company programs. So Social Security, you don't necessarily have to draw your monthly money benefit in order to get Medicare, and vice versa. You can get on Social Security early, for instance, and then be on Medicare as well, or you can delay your money benefit and then just get on Medicare when you're first eligible. So let's talk, if you just got this red, white, and blue card and you said, I don't need anything else but the bare minimum, I'm just going to get my red, white, and blue card. Here's how original Medicare works. So Part A. So Part A is a 0 monthly premium. So you earn your Part A by working your 40 credit hours. And what Part A covers is your inpatient hospitalization, your skilled nursing facilities, home health care, and hospice care. So it does not include custodial care or long-term care. So if you go into a care facility and it has a monthly premium, Medicare is not going to cover that monthly premium, but doctor's visits and things like that, they would bill your insurance for. So, and then Part A, so say you just had Part A and you go into the hospital. So all these copays on just original Medicare is what you would be at risk for. So you go into the hospital days 1 through 60, they're going to send you a bill for $1,676. So the first one doesn't sound too bad, right? Then you're in the hospital days 61 through 90, you're responsible for $419 coinsurance per day. Days 91 through 150 is 838 coinsurance per day, and then 150 days and beyond, you're responsible for all costs. So you go into the hospital, then you go to a skilled nursing facility. So Medicare usually covers those first 20 days. Then from days 21 to 100, you're responsible for 209.50 per day, and then anything 100 days plus, you're responsible for all costs. So there's over $80,000 worth of copays if you maxed everything out alone. So then you have your Part B, which is your outpatient services. So that's your office visits, your emergency room, your surgeons, radiology, labs, ambulance, ground, and air. The typical premium is $185 for 2025. So you earn your Part A and then you pay the monthly premium for Part B. So Part B, this is where you hear about the 80/20. So you have a $257 deductible annually and then 20% of approved amounts. So say you have a $100,000 procedure done, for instance, they would send you a bill for $20,000. $200,000 procedure, $40,000. So there's no cap on original Medicare. So it's an 80/20 unlimited. So most people, with that being said, most people don't just stay on original Medicare because it's 80/20 unlimited and there's no set costs. You don't have a worst case scenario. So Part B, this is where I mentioned on the IRMA tax. So your Part B premium is based on income. So let's say you file your taxes jointly. So the limit this year is $212. So $212,000 or less, you're in that first tier. So you'd pay $185 each for your Part B premium. From 212 to 266, it's 259, and then 266 to 234 is 370, and then if you jump down to $750,000 or above, you would pay $628.90 per month. So this is the IRMA tax. So it's affected in two parts. Part B is in boy, and then Part D is in dog. So also those two, Part B and D, have late enrollment penalties is what they're called. So when you're eligible for Medicare, if you don't enroll in Part B as in boy and D as in dog, then they're going to charge you a late enrollment penalty every month that you do not have the program. The only exception to that is if you're working and your work insurance is a qualified Medicare plan, and it has to be qualified under both Part B and Part D as well. So, and then we have the prescription drug. So this is the biggest change that has happened in 2025 is the Part B redesigned. So basically what happened, so 2024, so let's go back to last year. So last year on prescription drugs alone, not including medical, it had an $8,000 max out of pocket is what you would be paying if you took expensive prescription drugs. This year, they dropped that down to a $2,000 max out of pocket, which sounds good, right? But that $6,000 difference or that $6,000 swing between the two they threw the majority of that back on the insurance companies and basically said, you guys have to absorb this. So if the insurance companies have to absorb more cost, what do you think happens to the programs? That's why a lot of the premiums went up this year. That's also why a lot of the carriers, it didn't make sense for them to have certain programs. They pulled those out of counties and some of the benefits got degraded. So this was the biggest change that we're going through. So 2025 was the first year, 2026 is the second year, and then 2027 will have some changes with it as well. But 2025 is definitely the biggest year for changes. So understanding Part D, basically without a prescription drug plan, you would be paying full price for your prescription. So you can get lower drug costs. You also get that $2,000 max out of pocket as well too. So if you're taking really expensive prescriptions, say you have an injection or an inhaler or just a tablet or a capsule that's really expensive, that's going to cap you and give you a limit on what you would pay. Again, there's penalties for Part D if you're not enrolled, if you don't enroll in a Part D program when you're first eligible, or again, your work insurance or corporate insurance has to have a qualified Medicare program. There's formularies to them, and depending on the different companies, they just have different formularies. So obviously, if you have a standalone prescription drug plan and you wanted to review it for next year, I can run a formulary and we can look at the different carriers as well too, see if there's a different option there. Part D, so here's the limits for Part D. So this is the IRMA tax as well that we went over in Part B as well. So 2,000 or less is zero. You just pay the monthly plan premium. So say you choose a program that has a zero monthly premium. If you're under the $212,000 or less, then it would still be zero monthly premium. Say you jump up to that next tier, for instance, and you pay, and it's 212 to 266, that zero monthly premium plan, the government again says, oh, you've made more money, we can charge you more for this program. So they're going to charge you an additional $13.70 for that program. And then the most you would pay is the 85.80, which is a lot, going from 0 to 85.80 on a prescription drug. The IRMA tax is what that is. So on
Hey, Craig, can I just interrupt for a second? Just for everybody participating on the webinar today, if you're having questions come up in your mind, go ahead and use the Q&A section of it's up at the top there, and type your questions in and we'll try to answer those along the way. So we're throwing a lot of information at you, and just if you jot down your questions, we'll try and answer them as we go. So thanks.
So there are extra help programs is what it's called with Part D as well. So depending on your income, for individuals, it's $1,800, $2,250, or married couples, $2,465. So there are limits to where you get additional help through Social Security on prescription drug costs as well too. If you know people that are on those limits, or you want to see if you qualify for the extra prescription help coverage, let me know. We can do the application. It takes less than 5 minutes to do. It's a pretty simple process there. Coverage options. So with all that being said, there's really just two different choices, two different sides of Medicare. So the very first step is to get that red, white, and blue card. So you have to have Part A and Part B in order to enroll in the supplemental or the Medicare Advantage programs. So, and then you have the supplemental option. So basically the easiest way to describe the difference between the two is the supplemental option is just health coverage. So hospital, doctors, it does give you a higher health coverage, but it's going to be the most expensive and the highest premium. These are going to range from $200 to $300 per month in addition to what you're paying for your Part B coverage as well. So depending on your health issues, if you have a lot of health issues, these may make sense. So how that works is you would have a supplemental policy, and then you would just have a standalone prescription drug program. So you would technically have three cards. You'd have your red, white, and blue card. Then you'd have your supplement plan for whatever insurance carrier that you chose, and then your prescription drug plan for the pharmacy with the carrier you chose for that one as well. Or you have the Medicare Advantage. So Medicare Advantage is more as you pay as you go. So if you're on a work insurance or like on the marketplace, an ACA program right now, these work very similar. you have one card that you show, and it combines Part A's, it combines your Part B, and then gives you prescription drug plans. So with Medicare Advantage plans, though, depending on your health, they do have specialty programs. So say you have Medicare and Medicaid, they have programs designed for that situation. Say you have, they also have what's called C-SNP programs. So if you have like congestive heart failure, diabetes, or COPD, you qualify for certain Medicare Advantage programs that give you more medical and prescription drug coverage than just a standard Medicare Advantage program. And then the Medicare Advantage also started at zero premium. So on the Medicare supplements, the first two, so along the Wasatch Front, we have what's called a full portfolio. So we have both Medicare supplements and Medicare Advantage. So Medicare Advantage aren't available everywhere in the states, so supplements are the only option for people as well. So supplement G and supplement N, the first two right there, are the most popular. So say you got on a supplement G, yes, you're going to be paying around $200 a month for it, but it's going to cover your Part A hospitalization. It's going to cover the deductible, your Part B coinsurance. The only thing you would have out of pocket that year medically wise is your Part B deductible. This year it's $257. And then the excess charges it picks up, and then blood, foreign travels at 80%, and then your coinsurances. So a lot of health issues, a supplement can make sense. And then you have a supplement N. So these are a little bit less expensive, but you do have more co-payments and some other co-insurance that you would pay. So instead of it picking up 100% of the Part B co-insurance, you would have a co-payment. So if you went to like a doctor or an emergency room, you would pay like $20 or $50 as a co-pay. You still also pay that Part B deductible, and then you can get charged excess charges. So what excess charges is I've only really seen this in Summit County. The doctors feel like they can charge more than a Medicare approved amounts. And on certain programs, yes, you would be responsible as the consumer to pay those excess charges. So Medicare Advantage. So again, these ones start at a zero premium, and it combines everything just into one single card. So you pay your Part B premium, that we'll just say that $185. So you're paying the $185. They take that $185 and they pay that to the private insurance company. So whatever insurance company you choose. And then it combines your Part A, your Part B, and then your prescription drug plan. And all of the carriers, at least along the Wasatch Front, have what's called a zero premium plan. So you don't necessarily pay any more per month for this, but you do get the additional benefits. You also get a max out of pocket, and those are going to range from like $5,000 to $10,000, just depending on the program that you choose as a worst case scenario. So like we went over in the very beginning, that it has the $80,000 worth of copays on Part A, and then the 80/20 unlimited on Part B. This would protect you and give you a max out of pocket worst case scenario. Once you hit that, the plan would kick in and cover everything else.
Hey, Craig, do you want to take a break and answer some questions that have come in?
Yeah, let's do it.
Okay, so we've got a few questions that came in early before the webinar started, but the first one is, should I have double coverage through my employer and through Medicare? My employer is the primary provider and Medicare is the secondary provider. So I assume this person's still working past age 65 and has coverage through their work.
So it's a good idea now with how Social Security has changed the application to at least get Part A. So if you have Part A, again, you don't pay for Part A. You're just doing the application to get Part A, and then you get a Medicare number in the system. Once you have that Medicare number, it is a lot easier to add Part B later on in the future than trying to start from ground zero and then getting all the penalties and everything waived. It's just a path of least resistance. So I suggest at least enrolling in Part A. Does it make sense to have Part B and like a Medicare Advantage or additional coverage? It can. So I met with some people the other day. They had insurance through their work. So they have employer coverage there, but they have a $3,000 or $3,500 deductible with their employer coverage plan. So Medicare programs, most of them do not have deductibles. So yes, if he enrolled in Part B, and I gave him this option, if he enrolled in Part B, he would pay that $185 per month. So $185 a month, and then he could enroll in another program as well. So most of these programs don't have deductibles again. So that would eliminate his deductible with his corporate plan because he would have two insurances and it would just take it down to a copay. He gets injections in his eyes, and that's a 20% coinsurance. So in his situation, it's going to save him over $1,000 a year by having both, even though he's paying for his Part B premium, because it can eliminate that deductible there. In all cases, no. My recommendation is at least enroll in Part A, and then we would just have to have a conversation to see if it makes sense to be double covered just by health and use of plan. So
Okay, so it's pretty specific based on individual circumstances, and really at that point, if you should just talk to an agent like
yeah,
yourself.
absolutely. Yeah. Yeah. Because
Yeah.
some cases it doesn't make sense at all. It's just enroll in Part A and have that. And then say you're working 2 more years, wait 2 years, and then let's meet in 2 years. And yes, there's additional paperwork we have to submit. But at least getting your Medicare number is the hardest part. And then we can just submit those papers from that number because you already are in the system.
Okay. Great. And the next question's a little bit related to that too. It says if my spouse has insurance through their work, is there a penalty if I don't sign up at age 65?
So the only thing you have to be careful with is staying on a corporate or work insurance is if it's Medicare qualified. So if it's not Medicare qualified, the answer is yes. If it's Medicare qualified, the answer is no, you wouldn't have a penalty because her HR, when we go to submit the forms, they fill out the form, say, yes, he's been covered, it's Medicare qualified plan, and then that waives the penalty with Social Security technically, but drops over to Medicare.
Okay. Yeah. So that one again is individual circumstances. Are most employer plans Medicare qualified, or is it across the board?
Um, no, I would say probably like 75% of them are
Okay.
Medicare qualified. With the changes with the Inflation Reduction Act, though, so nothing has been said, and we haven't had what's called the final rule from CMS. So in that Inflation Reduction Act that's already been passed, that was passed in 2022, it said corporate plans are no longer qualified. So whether
Okay.
they're enforcing that or not is up to CMS, so the Centers of Medicare and Medicaid. They haven't enforced it in 2025, and so far we haven't heard that they're enforcing it in 2026. So again, with people that I met with a couple of days ago, I just said, hey, be aware if you get a letter from your wife's insurance, he was on his wife's insurance as well. If he gets a letter from his wife's insurance company saying this isn't credible anymore, we have to start this process early or else he will receive that late enrollment penalty. So that's just something to be aware of. Nothing set yet, but they're telling us they're going to enforce it at some point. The insurance companies just have to have time to get on board and transition those people over so it doesn't just create a huge bottleneck for them.
And is the goal of the government to basically get everybody on Medicare at age 65, even if they're working still and have
That's what it's looking
employer
like.
sponsored insurance?
Yes, that's what it's looking like. They want people, if they're eligible for Medicare, to go on Medicare. So it goes in like the Medicare pot for the cost sharing across the board. So yeah, it's
Okay.
looking like they're going that way.
Okay. So at any point, it's just a good idea, regardless of working or not working at age 65, about how soon do you recommend meeting with an agent? Is it 3 months before age 65, 6 months before age 65?
Yeah, three months before, for
Okay.
sure. 3 months before. I mean, I talk to people 6 months out, quite a bit just because they just want to know and they're nervous about how it all works. But yeah, that's not a problem. Like I meet with people either 6 or 3 months before is when we can actually start the process and do anything through the process. But 6 months to have a conversation and get and plan and just compare it. Like we can compare it. So a lot of people are reaching out to me now because the work insurance is going to have their renewal, right? And they
Yes.
say, this is going to be my work insurance for next year. What are my Medicare options though? Does it make sense for me to still stay on my work insurance or to go on to Medicare? And then again, that's individual. It can either make sense to stay on your work insurance or to go on Medicare just on price and how you're using the program. Spouses, if you have kids on the program as well too, things like that. So
Okay. Yeah. Great. Okay, one more question and then we'll let you continue. Is it better to get the extra insurance beyond the part A and B so that you have it and aren't dinged for not registering. I think
Is
basically the question is
so
A and B enough coverage for most people?
no, you have to have Part D as well. So you
Okay.
at least have to enroll in a prescription drug plan, and you can do that two ways. You can get what's called a standalone prescription drug plan where it only gives you medical coverage, or you can get it's an MAPD or a Part C program it's embedded in the program. But
Okay.
if you have Part A and Part B, there's no reason not to have prescription drug coverage because you're already paying for it.
Okay.
You don't necessarily have to. I mean, there's plenty of zero premium plans that have prescription drug coverage where it does not going to cost you any more money, but it gives you the additional benefits and gets you away from that late enrollment penalty for sure.
Okay. And you are able to stay on A, B, and D and not have a supplemental plan or an advantage plan. You're just going to be on the hook for that 20% of all costs that I think you're incurred, right?
Yeah, absolutely. Yeah, you can just be on A, B, and D. Absolutely.
Okay. Great. That's all the questions for now. If you have others, type them in. We'll be monitoring those.
So on the Medicare Advantage, we already went over kind of most of these, but most of them don't have deductibles. I think there's only two programs where we live, kind of along the Wasatch Front that do. Um, that have a deductible copay. So everything's a copay from the beginning. So you have your max out of pocket from like the $5,000 to $10,000. And if you go to like a specialist, you would have a specialist copay when you go to the specialist. If you get hospitalized, you would have a hospital copay. If you have a surgery, there'd be a surgery there or a surgery copay. And then providers are in network. So if you're on a work insurance program right now, it's the same thing. You're either on an HMO or a PPO is what they're called. And then HMO is you can only go to in-network providers unless it's an emergency situation. A PPO does give you some flexibility that you can go in-network and out-of-network. Just depends on the doctors that you're seeing. Additional benefits. So most of the Medicare Advantage plans, they have dental, vision, and hearing included in those programs. And then yearly max out-of-pocket limit. So that gives you the protection to where if something catastrophic happens, you're not on that hook for that 80/20 that's unlimited. Some have premium, some don't. There's only a handful of programs that have premiums. And then that's it for the Advantage. So if they have any more questions come through or contact info, happy to answer those for them.
We did have one question come in earlier before the presentation started about HSA contributions and Medicare, and the you have to stop contributing to your HSA 6 months before you go on Medicare, before age 65. Is that right, Craig?
Yeah, 6 months before. And then that's more of a tax issue than an actual Medicare. So it's a Medicare requirement, but it's a tax issue. So it's you have to, what is it? You pay a percentage or something back. You
There's an
can't have
excise tax.
tax-free
Any
funds going
excess
in.
con
It's the issue.
Yeah.
Yeah.
So any excess contributions to that HSA after if you don't stop them and they keep going in, there's a 6% excise tax that you have to pay on those excess contributions. So you can use the HSA dollars if you've saved up HSA dollars, before age 65, you can use those for all medical costs, including reimbursing yourself for the Medicare premiums. But you have to make sure that you stop funding the HSA 6 months before age 65. You're no longer eligible. All right. Looks like there might be some more questions coming in here.
Well, thank you guys for jumping on.
Yeah. So looks like
There.
that's all of our questions. So,
Okay.
well, thanks everybody. Reach out to Craig if you want individual advice on your Medicare options. Your wealth advisor is also happy to kind of talk through it with you and and recommend working with an agent, we're happy to help. Have a great rest of the day, and we'll talk to you soon.